All right, we might get going. So thank you everybody for coming to this month's presentation from our lovely colleague Vic Erskine. Vic is one of the members of the communication side of the School of Information and Communication Studies, and she's going to be talking to us today about her PhD work. And I know we've got some people from outside the university here as well who are also interested in hearing what Vic's been up to, because what she's doing is really, really interesting to people inside the university, but also much more broadly. So welcome to those people who have come from elsewhere. You're very welcome, and it's great to have you here. So I'd like to acknowledge first that I am living and working on the land of the Wurundjeri people of the Kulin Nation in Melbourne, and I'm very privileged to be able to live and work on their unceded land. And I know that there are people from all sorts of other lands here today, and I acknowledge the elders of those lands as well, and anybody from any of those communities who are here with us today. Thank you and welcome. So I will hand over to Vic, and she will take you through her presentation, and at the end we'll do some questions and answers. You can also pop some things in the chat if you want to do that. So I'll hand over to you, Vic. Thank you.
Thanks, Jane. Thank you so much. Thanks, everyone, for popping in and having a listen to this presentation. I hope you get something out of it, and I warmly welcome your perspectives, knowledge and interest. So any questions or feedback you've got for me, I'd really appreciate that. So thank you for the opportunity to talk about this work today. So there's my title. So I'm a PhD candidate in the School of Business, and in the faculty of, my supervisor comes from the Faculty of Business, but in the interest of multidisciplinary study, I'm also a lecturer in communication full-time and based in the SIX school. So very much a product of my research here in a multidisciplinary world. I too would like to acknowledge the Wiradjuri elders on the land on which I come to you today, which is the Bathurst campus of Charles Sturt, and pay my respects to elders past, present, and emerging, and the continuous and evolving ancient wisdom and knowledge on which we base our research methods in a contemporary academic environment. So a little bit about background from me. So I started my PhD journey about 2.5, 3 years ago, and through a little bit of serendipity, I landed in this amazing project called the Equally Well Project, and had the good fortune of finding an unexpected mentor and leader in Professor Russell Roberts, who kindly offered to be my principal supervisor at a time when I was actually struggling to find someone who I could connect with on that space. So along that journey, I've had the wonderful Jill Fenton-Taylor, who's an associate lecturer in Dr. Jill Fenton-Taylor in our school, to support and guide me along the way as well. So together, they've supported my research journey. I wanted to share this photo with you because this project that I'm currently working in, and is the context for my research, is the Equally Well Project. And that's the project team at our Lived Experience Forum in Melbourne in May. And it's just a sample of the really diverse collective members of that group. And I've got a real privilege to work with a really multi-skilled and diverse team of people, from researchers and clinicians, practitioners in the mental health space, lived experience experts, content experts, and a range of really interesting people that come together to try and do some good work, which I'll explain and unpack in a minute. So this journey started as a result of 25 years of professional practice in communication, and I've always been interested in how the communication profession evolves, and really open and curious about new ways of doing things, and this research really points me in the direction of doing that. So I've just wanted to start my research presentation with a little question. The title of my project kind of gives this away a bit, but this term continuous communication, which I'll unpack in a minute, is part of this model of social change called collective impact. And I'm interested because there's a number of communication researchers and professionals in the room to think about how you might define that term, continuous communication, because this project started largely because I was curious about where that came from. As a professional communicator, it's a term that I wouldn't use in practice, but from a research perspective in a social change environment in which I was a complete newbie, not an area of a field that I had entered into before. This term really threw me, actually, and then launched me into this investigation. So for those of you in the room, I'm going to come back to you about that question and see what you think once you've heard a little bit more of what I have to say. I'd love to hear your perspectives on that term. So the process is, is actually a summary of my confirmation for candidature seminar. So I'm going to try not to get too bogged down in too many of the mandatory details required for that exercise, and hopefully keep your interest along the way, but essentially run through my proposal and where I'm up to at the moment. So what is this thing called collective impact, and where have I come to on this journey? So in essence, we're living in complex times where governments, organisations and communities are all grappling with multiple complex problems, from things like existential threats to humanity, impacts on climate change, the rise of extremist politics, the evolution and emergence of AI and what that means, global financial instability, and the list goes on. The increase in scale and the number of risks and the place where risks are amplified in society is described by Homer and Dixon as a state of polycrisis. So the impact of these multiplicity of risks colliding is forcing new ways of thinking on systems and approaches that improve connection and also collaboration and mobilisation to make the change we all need to see and want to see in the world. So in this complex social environment, collective impact is one approach that is offering a suggestion to people who are interested in making big changes about one way that we can work more collaboratively together. So it's essentially a social change movement. In the social change movement space, collective impact promises a framework for genuine collaboration and collaborative solutions to complex problems by uniting previously fragmented groups through sharing 5 common themes and conditions to work together to find innovative solutions to complex problems. So I've come to this work through the lens of strategic communication theories as my research focus, looking at how participants in a complex stakeholder environment might work better together and more collaboratively for big social change. And I'll give you some context to what that's about in a second. So firstly, I wanted to start by describing what is collective impact, knowing and being well aware that until I launched myself into the world of Equally Well, I had no idea what collective impact was. So essentially, it's a framework. So it's not a theory within itself, but is a framework that brings a network of community members and organisations together with a focus on equity, learning and aligning and integrating multiple and diverse perspectives into one common goal for change. So the theory emerged from, the framework rather, emerged from social change activists Kania and Kramer in 2011 as a model that focused on collaboration and trust building between stakeholders as a key to effective social change. The scholarship around this framework is coalescing around themes in relation to the intention that it offers to take aim at genuine transformational change. So it's really trying to stir up the pot on what are traditional models for activating change in complex environments. So it's a framework for change that consists of a number of preconditions first. So individuals, organisations and societies and communities might identify a need for something, whatever that change may be, and to be able to activate that change, they need to first agree on what the problem is and identify that, have influential leaders that are willing to stand up and make brave choices. There needs to be some sense of urgency around that change, and they need to think about the resources required to deliver it. So with that background, Kania and Kramer in 2011 proposed that collective impact, there are 5 key tenets, they call them, or conditions, if mobilised, can actually make change. And those conditions are, firstly, that participants in a collective impact framework would agree to having a common agenda, so back to identifying what the problem is they wanted to solve and agreeing on that, that they would have make a commitment to shared measurement. So working on ways that they would measure the impact of the change they wanted to see in the world or in the context of the environment they're in, and contribute equally to measuring that change along the way. That they would develop mutually reinforcing activities, so they would work in new and collaborative ways to problem solve along the way of the journey of making change. And the fourth condition is the one where I enter, which is this concept of continuous communication, and that broadly, that communication would be open, transparent, and focus on equity and collaboration and building of relationships. Now, that point is the point in which I enter my research, and which I'll unpack further. The backbone organisation, essentially, that in a collective impact model, no one organisation will take the leadership for change, but it is very much there still needs to be a driver to that momentum. So the backbone organisation, and I use that term with loosely, provides the mechanisms, such as the project management, the leadership, the momentum to bring the rest of the collective together. So the application of CI in Australia is relatively new. In 2020, there was estimated to be about 90 collective impact initiatives across the country. I think that's significantly increased in the last couple of years, but there is a growing support from policymakers and funders using this model because they are seeing the potential it has to really open up opportunities for a diverse range of perspectives for big social change issues. So this research helps to understand how collective impact is being applied and translated not only in Australian but an international context, in specifically that taken for granted values within the framework, which actually add to of communication are better understood. So just to give you a quick background on the context, because I thought this was interesting and where I've landed. I've mentioned Equally Well a couple of times. What is Equally Well? So for those of you who don't know, Equally Well is it's actually a nationally funded movement in Australia that started in 2016 with the signing of a national consensus statement by, at the time it was about 54 organisations. It's now up to 100. Public health, so it's on policy direction, policy directed service providers in the mental and physical health space, all working towards this common goal of improving the physical health outcomes and wellbeing of people living with mental illness and promoting equity to access for physical health care as a basic human right. So our Equally Well collective includes the sample there: primary health networks, researchers, policymakers, clinicians, service providers, carers, and at the very centre of that are consumers, otherwise known as people with lived experience, and their carers or people who care for them. And all of those people are coming together to try and work on this particularly important issue for the health and equity in our country and across the world. So just some stats to back that up. The evidence is well and truly in on this, that 4 out of 5 people living with mental illness also have coexisting physical illnesses, and yet a lot of these physical illnesses are not treated with the same amount of equity as the general population. So a lot of avoidable deaths are happening by those living with severe mental illness because their physical health conditions are not addressed. Most recently, this snapshot here is out of a report that's been published earlier this year by our Equally Well collective about the mapping the ABS, Australian Bureau of Statistics, data against mental health service data from around the country. And the snapshot is that we're looking at people with mental illness dying approximately 2.4 times faster at a higher death rate than the average population. And that, equates to around 11 years. And certain interest groups have higher prevalences and are at more risk. So the issue is still alive and well. And while the movement in Australia has been going for a number of years and progress is being made, we're still mapping. So this is one of the shared measurement elements of this project, and working with others to try and reduce that risk. So there's just some latest stats. So in terms of back to my project, the research problem, are we still on that one? Yeah, is that around collective impact, there's this absence of empirical evidence about the element of communication and how that works in those complex environments in which collective impact has been operating. So in over 13 years of the collective impact approach in a variety of contexts, so it's being applied in education, climate change, poverty, lots of big social, complex social issues, there remains no clear and identified structure or definition around this element of continuous communication from the research to date. So while the conceptual clarity is lacking, detailed analysis of how this condition, which many of us will agree is one of the most critical, is affecting puts projects at risk or problems at risk, and the outcomes of those original conditions at risk if we're still not understanding what that communicative element of those projects or of those issues is really all about. So it's a commitment to so this research is really looking at understanding that more about the element and factors that contribute to continuous communication within collective impact models, and then providing that through this the approach I'll take, conceptual clarity and rigour, and a potential new instrument for those to contribute to the collective impact framework, and hopefully enhance others who are implementing this kind of process in the future. So the objectives are the literature gap, essentially, to add and understand more about how communication functions, to develop an evidence-based model, and then hopefully provide recommendations to improve the effectiveness of collective impact as a model for social change, and specifically around communication. This work is, when I say it's novel, there's not a lot of communication research that I've been able to find to date around collective impact. So in the broader scope of collective impact research, it's a relatively untested space. There's been around 1 million downloads of the original Kania and Kramer article on collective impact, which appeared in the Stanford Innovation Review in 2011. But to date, there's relatively few empirical studies about the complex nature of collective impact. So my literature review will show you, there's a number of studies out there, but in terms of interrogating each of those elements, there's still relatively few. So in this, it gives me an opportunity to test new theoretical approaches and build an evidence base to continue to contribute to that ongoing learning about about collective impact and social change movements. So so my work is really, I'm applying a mixed methods approach. I don't know if I went back I'm straight into the literature review before I get to the process of the methodology. But so where I started was thinking about what's been going on in this space to date. And because this is a mixed methods approach, I am starting with thinking about the scoping the literature. And sorry, back to that, I'm using a grounded theory approach in the first stage of my work. And in that sense, following Sharmaz's lead, the literature review process is a little, is not meant to stifle that journey of discovery that happens when you dive into the collection of the data, but provides some shaping and framework, which is what's happening. So I wanted to identify what knowledge was out there about the concept. I wanted to locate some of the qualities and characteristics from the existing literature, and then better understand that to move into how the first stage of my work. So this process, the methodology I'm approaching is, I'll go into that in a bit more detail. I'll just look into, I'm applying a mixed methods approach essentially. So I'm beginning with the constructivist grounded theory framework that positions this work as a construction of knowledge of what's happening in place, which in this context is the collective impact of equally well. And I'm taking an approach where the construction of new theory is happening through the process of listening to and exploring the experiences of those participants within that setting. So where did the literature review process take me? So originally I started out by searching the term collective impact and continuous communication and looking at communication within that setting. And that revealed a number of, there were several hundred in the first broad scope, but when I narrowed that down to relevant to my study, it became a relatively small pool of research-focused studies that looked at or explored the concept of communication. So I was looking for original research output using either qualitative or quantitative approaches to exploring communication. And what I found was the overall results found that while there's been a lot of well over 2,500 academic citations of that original Kania and Kramer article, the breadth and scope of the empirical research around the elements of collective impact are still, are growing, but are still relatively small by comparison. So the main development, so that was sort of essentially the scoping of the issue, and I saw immediately a gap that I could enter with my knowledge and experience and curiosity to interrogate more about this the element of communication. So the clear evidence, what I was looking for initially was some kind of conceptual definition, which is why I've posed that question at the beginning. So a number of researchers have identified what continuous communication is within collective impact, and I've put this up as more for those who are interested in knowing a bit more about defining the concept. The clear evidence is that it's broadly defined as a condition for mobilising stakeholders, building trust and challenging power imbalances. So a number of researchers have also identified that continuous communication is the condition that contributes most effectively to the building of trust and forging of new relationships, and that is described as both a condition and a responsibility or function within that fifth element of the collective impact model, which is the backbone team. So essentially it's critical, it's meant to be open, it's meant to be the factor that for sharing information and building stakeholder relationships. But in terms of evidence of how that's working, that's where the gaps started to emerge. So in that literature review, I started to then look at some of the themes out of the studies I could find, and a number of elements started to appear. So understanding what are those attributes that contribute to continuous communication, the concept within the collective impact framework. So what I was looking for was a number of instrumental conditions, and these are the ones that I found. Certainly genuine engagement, or community engagement rather, is the first one. Now, those practicing communication will understand this is a key element of the work of strategic communication. But essentially, scholars agree in terms of community engagement that genuine community engagement requires specific skills and experience in negotiated relationships, and that this element within collective impact has been under-researched in existing literature. Many researchers, including Rita Strong and Boyer Robinson in 2016, Ennis and Toffer, Abresh in 2021, and others acknowledge that community engagement is essential in a skill-building way to build and maintain trust within collective impacts, but it's not necessarily investigating the communicative element of what builds those trust is under-researched so far. Trust is another central theme that in collective impact literature, and is described as building and maintaining is needed to require to build and maintain effective collaborations. So it's a consistent theme in the scholarship, and the link between ongoing communication, relationships and trust is critical to enacting success that collective impact movements are trying to achieve. So the failure to invest in trust building activities or address this specific skill within backbone support structures, for example, or facilitate and lead trust building activities could prove a potential risk to the ambitions of any new collective impact model. The fourth condition that I found was well explored, or to somewhat extent was explored in the literature around communication and collective impact, was relationships. So the building of new relationships and strategies to create innovative connections and partnerships is cornerstone to collective impact work, where those existing structures have failed to address an urgent or complex problem. So in the context of collective impact, you've got multiple and complex, equally well, you've got multiple and complex health and mental health environments. The problem is not new. The solution to solving the problem of that life expectancy gap is the challenge. So scholars agree that well-intentioned stakeholders can often fail if they underdevelop the capacity and resources to establish and nurture effective relationships. And the fourth condition that's coming out of this great understanding is how leadership functions, communication influences and functions within a leadership of collective impact. So grassroots voices in collective impact models are given equal power to influence system change over more traditional leadership models. In the Equally Well collective model, all lived experience experts are co-leads in all elements of the project, as an example. So leadership within collective impact is collaborative, and the backbone function is not so much the traditional leadership role, but the facilitator of other leaders within the network to build connection and build partnerships across those complex interdisciplinary participants. And it's the movement, it's leadership in this space is about activating other participants. It's about being accountable and listening to help others act for rather than on behalf of the participants within that network. So as equity and power sharing pose a challenge for collaboratives, scholars need to insist, or this is what researchers in collective impact are telling us, must insist on solutions being discovered that honour the experiences of all. So essentially, there is as yet this largely untested imperative continuous communication, but what we do know in summary is that engagement needs to happen from early stages. Communication in this function requires specific skills in negotiated relationships, that it's absolutely conditional to building trust, and it's needed as a capability for making connections between that disparate and diverse network. In terms of theoretical frameworks that are driving this work, I'm coming at it, as I said, from a strategic communication perspective. So it's informed by frameworks around communication scholarship. In particular, I'm, drawn to the work of relationship management theorists, organisational listening, and I've noted McNamara there, and the co-creational concept of strategic communication theories already worked on significantly by Botan and Taylor and others in this space. The framework of collective impact is over the overarching umbrella, but I'm very much bringing my strategic communication lens and researchers in that space to potentially inform how that might improve the work of collective impact or influence the model in some way. So what is key in this is understanding that communication applied, so where my perspective lies rather, is that communication is applied through a strategic framework, looks at aligning goals and objectives and activities, it looks at relational practices, it looks at listening and communication as outcomes, not outputs. So very much looking at how communication within any environment, but particularly in this complex stakeholder environment, is the product of the relationships and the processes and policies and actions in place of the whole collective. So it's not thinking about strategy as a transactional direction, but rather a collaborative approach. And continuous communication, so far as we know, requires specific skills in negotiated relationships, but how that actually works and the limitations and hopes for that work are still yet to be understood, and that's where this work enters. So the research question, essentially, it's so back to the process. I'm looking at a mixed methods approach, and the hybrid research question in that context is really thinking about what are the experiences of those practicing communication, continuous communication within a collective model, and how can those factors be measured to contribute to a new and enhanced model of communication within collective impact. So I'm starting with the qualitative process, and actually I'll just go through the model next just to speed it along. So the qualitative data collection analysis is where I'm at this point in time, and then I'm moving through in this sequential mixed exploratory sequential design into the developing out of that process, developing an instrument to be pilot tested and then evaluated. So in phase one, I'm looking at individual interviews. That's edited, I'm up to around 30 interviews is what I'll be doing in this, following Sharmaz's lead on grounded theory construction. I'm interviewing participants in Australia, New Zealand, the UK, and some other international participants who have some experience in the collective impact model. That's the process there. They will be people who have worked, may or may not have a specific title in their role as communication professionals, but they will certainly have experience in the communication function within some role, and they are quite diverse within the collective, the Equally Well work that they're doing. So looking at project teams, I'm looking at lived experience experts, I'm looking at a range of diverse experiences. So yeah, I've just started this work and it's very exciting what's emerging so far. In phase 2, I'll be taking that data analysis and developing an instrument to be tested with specifically a sample of consumer groups from, sample of participants within Equally Well Australia, and looking at how that model stacks up with their approach to the communication element within the projects. So that's where that'll be going for phase 2. Again, these participants will be from those specific sectors of the collective impact model in which I'm operating, which is Equally Well. So I'll be talking about consumers, those with lived experience, primary health networks, government, non-government agencies in the health and mental health space, and researchers as well, who are also exploring that area of physical and mental health. In phase 3, I will then be looking at the potentially, and I've put structural equation modelling there as a start, but we're not necessarily defining this yet, looking at testing that pilot research, that model, and seeing how effective that is in terms of a new approach to continuous communication within collective impact. So the ethical considerations, all participation in this is voluntary, of course. I'll be working with backbone teams. I've certainly laid out the fact that I am part of one, and that also creates an interesting perspective in terms of this work. And participants will be invited to take part and offer their perspectives at various times. With the research, the ethical consideration so far is that because this is about communication, it's not about mental health or lived experience of mental health conditions, the risks are relatively low to participants. So the aim of this work is to contribute to that body of knowledge about how collective impact as a framework impacts social change and big social change. And I also want to explore new and evolving ways that strategic communication operates in complex stakeholder environments, because at the same time that social change and big issues are happening, there's never been a greater need to understand the communicative elements of change and what contributes to and what the barriers are to individuals, organisations and society in general making the change that needs to happen to solve complex issues. I'm actually already underway. I've got a publication underway. So there's a publication strategy alongside this work that aims to continue to contribute to what's going on within the research space, because there is so much change happening within collective impact. The model is picking up pace, and I want to keep pace with that, as well as contribute to and learn from others along the way. That's the timeline. I'm following. I'm so far on target to complete the thesis by submit the thesis somewhere early to mid 2026. So that's kind of it in terms of the formal side of it. I'm really open to questions or going back and exploring anything that people would like to know more about. And thank you for your time so far.
Thank you, Vic. That's very interesting. Lots of new things for me to think about in there. I'm sure the same for everyone. Okay, well, if anyone got any questions, you can put them in the chat if you'd like, or come off mute and speak with your voice.
Please use your voice. Or words, that's fine too.
I think, Crystal, you're speaking, but your mouth's moving, but we can't hear you.
Crystal.
Can you hear me now?
Yes, we can.
Oh my goodness, that was clever. Thank you, Vic. That was amazing. I really enjoyed learning more about your project, and I also want to acknowledge how big it is. You are blowing my mind with the size of it. So very excited to learn more. While you were talking initially about your continuous communication, and then you started talking about the area that you're doing your research in with all the people who are experiencing various different health conditions, it got me thinking about health literacy and the way that that impacts, their ability to get that message that you're trying to get them across. And I was just wondering if you had any consideration around that. Yeah.
Yes and no. So yes, literacy, health literacy is a big part of this. And there's another piece of work which I didn't include here. Scale, yes, Crystal, it could be massive. So I've tried to, when we talk about strategic communication, and my colleagues will know what I'm saying here, it's not just the big picture operational outputs. It goes right down to interpersonal relationships and communication and how that's founded. So I've had to essentially move out of that nuance to try and look at it from organisational perspectives. So I am thinking more about how organisations work together more collaboratively to operationalise communication systems and networks and functions in that network, and not so much on the patient clinician roles in communication, but inevitably it comes up all of the time. So I guess my contribution is to consider whatever context that communication or continuous communication arises for you in the equally well space. There's some I think the work in strategic communication has relevance across the board. So I think while that's not the area of my work, it's coming up all the time in lots of conversations. So I'm not ignoring it. I'm just focusing on the organisational communication context and seeing what comes out of that, and then we'll see where it goes from there.
Yeah, for sure.
And Crystal, it's Russell Robertson, one of Victoria's supervisors. Sorry, I came in late. But you raise a super important point that's always resonated with me. And it's actually about the fact of health services that get millions and some of them billions of dollars to run programs are in fact communication illiterate. So they're health service providers, they're mental health experts, etc., and all their training is in mental health, but they're communication illiterate. And this is really the work but so much of the impact depends on communication. And I think this is where Victoria's work is. We really identified the whole gap, even in collective impact, that there's just this sort of black box of continuous communication, but no theory about, well, how does this work strategically to meet the organisation's aims? So, I think in health, we're conscious of health literacy, and it's a big issue, and there's research there, but really not conscious of the communication illiteracy of health services. And it really compromises the public value of what that service is charged to do. So it's an awesome point. Thanks.
Yeah, I just had the thought, Vic, that if you're, once you're finished with this massive project, afterwards going in down that side of like bringing together that and the health literacy and bringing on maybe even Kay, because health literacy is one of her things. So yeah, just a thought.
Thank you.
Any other questions? Roz?
Rosie.
That was so great, Vic, and congratulations to you and your supervisors for mapping such an intriguing project. I don't know anything about continuous communication, and I really kind of love it, actually. I think it's such an interesting and important focus for what you're interrogating. And I just wanted to add into something that Crystal and Russell spoke about just then that kind of links back to some of my work as I've looked at immunisation and communication around immunisation, and the World Health Organization says that vaccine hesitance and people not understanding why they need to immunise and how imperative it is to protect all people, blah blah blah. That they name vaccine hesitance as one of the top 10 threats to world health, and what it resonates for me there. It's not the actual problem, like a disease or a virus or something that is in amongst the top 10 threats, is the fact that people don't have a proper understanding and, a commitment, I guess, to those kinds of things. So communication around health is almost as important, the World Health Organization tell us, as attacking the problems or the situations. And so I think you're really onto something that's really powerful and important, and I commend you and wish you well with it.
Thanks, Roz. And yeah, your insight. I know, I'm well aware that in the health communication space, I'm not. That's certainly not a background that I have either. But so, well, you do. I don't. So it felt a bit novice to be in this space. But the really amazing thing that's happened so far, and I mean, equally well, actually launched, and Russell could talk more to this, but a vaccine awareness, international. Memorandum of understanding between a number of organisations about vaccine access for people living with mental illness during COVID. So that became a public campaign that was run internationally to try and increase equity of access to vaccines.
Mm-hmm.
So, yeah, that's just another side issue, one of the preventative health measures that don't get the sort of attention that it should for certain groups. But when I was speaking and presenting this work to a collaborative of international health leaders who work in this physical and mental health space recently, the emerging theme, and I had it here to show you, but I've lost my PDF, about after getting together for a couple of days and talking through a lot of the challenges and problems and barriers to how we continue to close this gap and work better together, communication just rose to the top, if not one or two outcomes. So we put a list of actions together as a result of that collaborative event, and building better communicative networks, understanding communication better. And I'm just sitting there going, yes. Did I have anything to do with influencing that? Possibly. But I just kept asking questions. And when you ask the question, what is continuous communication and how do you use communication in your own work, lots more questions rather than answers were raised. And so I just think it's ripe. And it's ongoing and it's changing. So we just got to keep doing it.
Yeah. And it's not, the world is not a blank slate waiting to hear our messages. It's,
No.
It reflects the complexity of trying to share important health information or any other kind of information in the complex environment in which we find ourselves. People are not just sitting there waiting to hear whatever and blindly accepting it. And that's what makes communication, challenging, but also, imperative for bringing forward these kinds of reforms and initiatives. Yeah.
Thanks, Rosie.
Annie, you've got a question.
Yeah. Hi. Yeah, so this is, my camera's not working again. This is probably a very basic question. So obviously there's a difference between many to many and one to many continuous communication, and you would think that there might be some kind of trade-off, obviously, because there's an expense in many to many which you don't have with one to many, and so it's obviously easier to continue, like a constant stream of good health data or health information, which is difficult. And then once, of course, you get many to many, how is, who's controlling it? So maybe this is all basic stuff in continuous communication, but I just thought I'd ask because that's not clear to me. Yeah.
Thanks, Annie. It's not basic at all in terms of, again, to the point of understanding how much is too much, how little is too little, and who knows what about anything really, and how to when you're looking at organisational perspectives, particularly, organisations will come to this problem with their own agendas and own priorities, and then you put them into these collaborative complex spaces with multiple different with all those people coming, all those individuals and their organisational agendas coming together, and they've got to continue to understand and then activate some change from the policy to the practice level. And you can see that it's not just about messaging and campaign building and outward sending sort of mass media approaches. It's actually about understanding how people build better relationships and create trust to activate different ways of working, essentially different ways of delivering services, different ways of funding, different ways of changing clinical health practice guidelines. There's all these different elements in this complex environment. And so there's a scale, and continuous communication, broadly is this sort of open environment, but essentially it it can also mean, and this is where I'm interested now, if anyone wants to contribute what they're thinking is, it can just mean fast and furious. It can mean, continuous could just mean mass messaging or mass, doing lots of something, not necessarily achieving anything out of it. Or it could be something different. And I'm just trying to understand and distill how people within those networks have communication literacy, to organisational communication literacy, interpersonal communication literacy, to be able to effectively activate each other and make the change they're looking for. I don't know if that answers your question, but...
Thanks.
Right. Deb.
Look, I've just got a comment rather than a question. Well done, Victoria. This is so exciting. And just to echo what Roz has said as well. And look, even just in your response to Anne then, I thought that was a really, really great response. I see it having applications way beyond health, as you say, any kind of social. I was involved in a project with 60 local councils, and trying to get those 60 local councils to all come together, representatives, we had like this collaborative process, and it was just a nightmare. Like, there was so many egos and personalities and contentions between different councils, and I think another thing sometimes is when you bring people together from different spheres and things like this, there's sometimes a little bit of a fear to speak up. Is that something that you've seen in your work? A hesitancy to kind of communicate openly? And does your framework kind of help that?
There are certainly power dynamics in collective impact work, and that's been actually quite acknowledged in the literature, because you're dealing with perhaps potentially vulnerable populations, people, vulnerable, I say, less empowered, or people who've been disempowered consecutively over generations. And then, think about patient and doctor relationships. The mental health sphere is full of stories of challenging, where the voice of those people with the expert lived experience hasn't been heard. And as a result, we've got this issue with physical health, massive gaps in physical health lifespans or health equity. So there's those issues are at that level, but then so beyond in terms of the change, yes, there is a power. There is an acknowledgement of power differences, and that's why collective impact work and the role of communication in that work is so vital, because it's about realigning those power challenges, those inequities, to try and keep people on the same playing field. So we had for the first time, and Russell will know the experience of this. There's been a number of symposiums in the Equally Well world. I think there's been 3. This year we reframed it a little bit and put lived experience design at the centre of that forum. A slightly different approach, a little less research focused, a little bit more lived experience centric, co-designed with our lived experience experts, and the whole feel of the event changed. Now, it wasn't the same event. There's a place for research symposiums. There's 100% a place for clinical practice experts and all of that. Sometimes when you bring them together, that balance and the history of that inequity is still there. So we have to work deliberately and really hard at doing things differently to shift the lens so that we can recalibrate on what is most effective. So the word intentional communication somehow means more to me than the word continuous in this space, as far as I've had the experience. So I'm thinking about ways in which communication needs to be we need to intentionally think about it, plan it, resource it, and be aware of how that functions in these, to exactly do that. Minimize the risk of those personalities and agendas derailing rather the goal.
Nice response. Thanks very much, Victoria. Well done.
And Deborah, I might jump in here. Firstly, I think I'm in the wrong school. I've never had such a great conversation. I'm just going to change
Told you
schools.
that.
No, people communication.
But your point, there is fearfulness to speak up for various reasons, and Vic hit the nail on the head. And there's power dynamics there. So people with lived experience have been used to being traumatised and not listened to, and when they're contacts with health services, so they're reticent to speak up. So we try, as Vic said, and equalise that power dynamic by putting lived experience at the front, but also our partnership with all of the state governments. they don't want to speak up because of reputational risk and the risk aversion of state services. And so one of our mantras, which is like, we have no power of censure, we won't do this, we're a small team in a small regional uni here to help you. So to give them an opportunity to share more openly, because I was an ex-public servant, and we're not about embarrassing, we're about supporting. And that way that opens up that conversation. So, you know, it's interesting, some of the powerful don't want to speak up because they don't want the risk, the reputational risk, you know, with the Sydney Morning Herald, etc. And some of the powerless don't speak up because of a history of being systematically marginalised. So there are all these power dynamics we're trying to manage. And with this conversation makes me realise how complex this project is, Vic.
Oh, thanks for acknowledging that.
Are there any more questions at all? I was thinking when you were talking then, Vic, about I'm involved with a group that's bringing people together to talk about education in prisons, and they've been doing this for ages. And for the first time earlier this year, we brought in people who had tried to educate themselves or take advantage of any education that was available when they were in prison. So we had that expert lived experience voice, and it didn't work well at all. It was really interesting because they came in and said, well, you know, we didn't get what we felt we could get, and there wasn't enough, and it was poorly delivered, and they were really, really hypercritical of it. And the educators who were also in the group got very defensive and said, well, you know, it's tough to give you anything. You expect more than we can give you. And it was a really interesting exchange to get that voice in there, but it did create a whole new set of problems that we hadn't been even thinking about, but it's good things to be thinking about.
Which is, I was going to start this with using you all as part of my experiment by asking you about a project or an opportunity or an environment in where you've had communication has worked really well, and what the ingredients are to that, and try to distill them, and perhaps an experience where it hasn't. And how much time do we actually spend investigating that? Pretty much not much. I think we'll find we've all had experiences where often it's a communication breakdown. And now I'm talking about interpersonal, but it's usually an organisational, perhaps an inability to have deliberately focused on the communication aspects of that work. It's just delivered, like projects are just run out. And this is something that came through in my conversations overseas recently, was thinking about communication as a deliberate. And so this is back to our strategic communication research and practice. There's a process around, there's a reason why that research has evolved. Complex communication is complex. People are complex. Humans are incredibly complex. And when you put them together to make really difficult and challenging environments, it even, just adds to that complexity. So understanding the nuance of what does good communication look like from a team's level, from an organisational level, from a backbone team who's bringing all these other organisations together, and when doesn't, what does success look like? It's about capacity building, everyone, because communication is everyone's responsibility. It's not just the comms team. And what often happens is the comms team become the people who are the default, or they're brought in at the last minute, and those the capacity of others is diminished, or they actually stand back and say, that's not my job. And they don't do it well, and yet everybody has a role to play. So it's about creating better systems where we're capacity building others to recognise their own gifts, talents and strengths, and then in a systems-wide approach, expanding that knowledge.
Excellent. Fantastic way to end. Thank you so much, Vic. Tina's got her hand up. We've got a little bit of time.
I just want to comment. This is a very interesting topic, a very important topic. It's not only to investigate. I think the companies, government agencies, non-for-profit organizations need to invest that. So there could be a lot of potential opportunities to do, contract research or encourage kind of the grants with those organizations. We need to invest this communication. And I do love the intentional communication concept. Thanks.
Thanks, Tina. Thank you. Thanks for coming.
All right. Thank you, everybody, for coming along. Thank you, Vic, for sharing your work. Good luck with it if you continue through. And we'll look forward to some updates on what you've discovered.
Thank you so much, everybody, for your attendance, and appreciate your feedback and comments sincerely. Thank you so much.
Right. Thanks, everyone. Bye.